Hey guys, this is Dr. Hub. Today we'll look at the clubfoot and the primary and the secondary deformities. So in terms of the clubfoot, there is a primary deformity. It includes the equinus. Next is there is also the varus, then the cavus, the forefoot adduction, as well as the internal tibial torsion. There is internal tibial torsion. Now let's move on to the secondary deformities. So in terms of the secondary deformities, it involves the concave medial border. So there is presence of the concave medial border and also the convex lateral border. So there is concave medial border as well as a convex lateral border. And there is also reduced foot size. There is presence of the reduced foot size. The forefoot, if you see, the forefoot is going to be plantar flexed. The forefoot is going to be plantar flexed, and the skin, when you look at the skin is going to be stretched. The skin is stretched over the dorsum of foot. So skin is stretched over dorsum. So dorsum of the foot. And then there is also presence of the stumbling gait. There is presence of the stumbling gait, and there is atrophy of the leg muscles. There is atrophy. So that's atrophy of nothing but the leg muscles. So here important, the primary was the equinus, varus, cavus, forefoot adduction as well as the interior tibial torsion. To learn and grow daily like this, please do subscribe.